Welcome everyone to the Santa Ana Communication Linkage Forum meeting. I'm Margarita Macedonio, and with our team, Alyssa Ventura and Narcy Perez with the city's neighborhood initiatives team. So we welcome you tonight. We'll wait for other people to join the Zoom meeting and we'll shortly get started. Thank you. Once again, we welcome you to the ComLink meeting tonight, Thursday, January 28th. And we will be starting in a couple of minutes. Thank you so much for joining us. All right, we're going to get started. So thank you everyone once again for joining us at the ComLink meeting. We have an important agenda, and I wanted to turn it over to Carl or Peter from the ComLink board to get us started.
Well, I want to welcome everyone, and seeing that this is our first meeting of the new year, first thing I want to do is wish everybody a very happy and healthy 2021. And I hope those that we're reaching tonight are in good health and good spirits tonight. As Margarita said, we have a very important meeting, and we're very happy to have the city manager and the captain of our fire department, who's been handling the rollout of all the vaccines, to come talk to us and where we stand with everything. We'll go ahead and start this meeting as we start all our meetings, and that's for the Pledge of Allegiance. And Peter, could you lead us, please?
Yes, sir. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Peter. Let me start off by introducing Peter Katz, who is our president of ComLink this year on it. Myself, I'm vice president. Evangeline Goronsky is our secretary. Leon Jacobs is a board member. Terry McCullough is a board member. Irma Marcia is a board member. And George Collins is a board member. Because of COVID, this board has stayed on an extra year because we thought we had difficulty having elections. And so we will be with you throughout the beginning part of this year, and hopefully by June we're back together and we can get back to normal at that time on it.
Thank you, Carl. And thank you, Peter. Alyssa, did you want to go over some of the slides before we just wanted to share some reminders. Go ahead, Alyssa.
Yeah. Hey, everyone. So for tonight's meeting, there are a couple of ways for you to participate. So you can use the raise your hand function, which should be on the bottom of your screen. which is this little hand feature. So if you have any comments to make, or if you want our attention, use the raise your hand feature and we'll get to you. And then you can also ask a question in the Q&A box. So yeah, just type in any question that you have and we'll try to answer your questions throughout the meeting. And those of you that are dialing in, I do see that there is one phone call in listener. In order for you to raise your hand, dial *9 and then dial *6 to unmute yourself to speak during the meeting. So those are a couple of ways for you to participate. And then we do have Spanish interpretation during the meeting. We're going to get that started. So in order to start the Spanish interpretation, look for the little globe on the bottom of your screen and then click on the Spanish language. Thank you.
Thank you, Alyssa. Carl, I'll turn it back to you for our first special presentation or discussion.
Well, I'm really very pleased to have our city manager, Kristine with us. Her and her crew have been extremely busy this last year. They've put together Santa Ana Cares, which is amazing. I know very few cities that have much offering as what they've offered the citizens of Santa Ana and pulled that together on it. As well as she's continued to show great leadership during these difficult times. And that's why our city's running as well as what it is. So city manager, can I turn it over to you?
Certainly, and thank you, Carl, for that very generous introduction. And good evening, everyone. Thank you, board members of Comlink, for inviting me to speak at your meeting, and thank you for continuing to provide an opportunity for communication to get spread throughout our community. It's really hard to believe that very soon it will be 1 year that our lives have been turned upside down from a little thing called COVID-19, something none of us probably even knew the word prior to this last calendar year. For all of us in local government, it has been a tremendous challenge, a challenge to fight for resources to try to meet the demands of our community. We have many, we still have a lot of needs out there, and to fulfill them, it's been difficult and rewarding to the extent that we have been able to fill some of those. We have struggling individuals, we have struggling business operators, and even children in our community that are trying to adjust and learn remotely. So it has been a very pivotal moment, I think, for local government on trying to figure out, how to react to this. This is something that hasn't happened in our country since the Spanish flu in the early 1900s. COVID-19, unfortunately, has had a greater impact on our city than some of the other communities. The good news is I sincerely believe that there is a light at the end of the tunnel. So tonight, what I want to talk about is I want to spend a little time talking about what we have done in response to COVID, what we're currently trying to do, and what we hope we will have the opportunity to do in the very near future. Our first response when the community was hit with COVID was to really determine what the needs were that were out in our community, from individuals to businesses. And then the struggle became finding the financial resources to roll out the assistance that was needed. Under the original federal CARES program, local governments that had populations of 500,000 or less did not receive direct allocation of funding. Unfortunately, the county shared some money with us, and the state really came through and provided us the majority of our funding. With that funding, we were able in a very, very short period of time to turn around and program it and get it out to the streets where it was needed. We rolled out programs that provided millions of dollars in rental assistance, utility bill assistance, childcare assistance, artist grants, business grants, and much more. We provided over 35,000 free COVID tests in our community. We handed out 300,000 masks in our community, and our care team, which you had mentioned earlier, Carl, they really took the resources out to the streets and directly to the residents that were hit hardest in our community. Those CARES dollars did run out. They were completely exhausted by the end of last calendar year. but we still recognize that there are great unmet needs in our community, and the virus continues to spread. Unfortunately, our community, Santa Ana, has lost 500 lives due to this pandemic. Right now, we're trying still to offer the assistance that we can, taking a battle to get the needed resources. And some of the good news has been that our existing federal programs, mainly in the Housing and Community Development Department, have received enhanced funding streams. So that's going to help us out a lot. And then as we try to also get additional money so we can keep up the programs. A lot of the programs that we had in the CARES, some of them can continue, but with the bill that was passed over the holidays, there is a lot more money that is being programmed for direct assistance. Unfortunately, none of it is directly being allocated to local governments such as ours, but there is direct assistance going to the individuals in the form of checks. There's additional unemployment benefits, and then there is a whole host of different programs for small businesses. Under the leadership of our council, we have been able to maintain a strong rental assistance program. And most recently, council authorized us and provided us funding to restart testing in our community. The previous testing that we hosted did end with those CARES dollars, but we will be beginning testing next week for Santa Ana residents only. It will start on Wednesday, and it will run Wednesday through Sunday, 9 o'clock to 4 at Santa Ana College. An appointment is required, and you will soon see the information posted on our website on how to schedule your appointments starting on Monday. There also is some positive news for our business. The governor, as you probably know, just this week, he lifted the stay-at-home order, which means outdoor dining can resume, and some other businesses are able to open with restrictions. So with the lift of the stay-at-home order, we still remain in the purple tier. So the businesses that can open in our city do have to comply with the restrictions that are posted on the California's state's website. But that is good news for the businesses that have had to, go through, I can be open, I have to be closed, I can be open again, I have to be closed. So hopefully we will improve our numbers and actually be able to move into a tier that has even less restrictions on our business. We also have some great news for struggling tenants in our city. Just also very recently, the state legislature did pass, and they extended the moratorium on residential evictions all the way through the end of June this year. So that was something that we had received a lot of input on as to whether that was going to be extended, because we do have a lot of rentals in our city, and we did have some tenants that were really hit hard with that. But of course, what you probably want to hear the most about, and what the brightest news is that the vaccines are rolling in. Although my personal opinion is the rollout of the vaccinations in our state and in our county, it has been extremely complex and it has been challenging to find out information as to where the vaccines are coming from, who they are going to, and how many people are getting them. It changes by the hour. I do know that in the very beginning, the vaccines that made their way to Orange County came in 3 different ways. From the federal government. The first was the federal government contracted directly with drugstores such as CVS to provide vaccinations for the seniors that were living in skilled nursing centers and other senior living centers. So obviously some of those vaccines made their way to Orange County. The other was a direct allocation to regional hospital networks within our county. So these are the big hospitals. These are the Kaisers and the St. Joseph's. And then there was a direct distribution of vaccines to our county of Orange. From that population of vaccines, which wasn't that large, I think on some counts, it was only maybe 20% of the distribution. The County of Orange did provide vaccines to the local hospitals, and then use the other vaccine to to give to the individuals that met whatever the requirement was of that day as to who was allowed to have their vaccinations. It has evolved since then, and there are other parties that appear to be getting a direct distribution of vaccines. The county has committed to the super site model, and you probably know Disneyland is open, although there has been some closures due to rain and winds. A second site, Soka University in South Orange County, is open. I believe the third site that they want to open is the fairgrounds in Costa Mesa. So those are the vaccination sites. And at this point in time, they are vaccinating 65 and older. Seniors are the ones that are qualified for it. But each day, hour by hour, things keep changing. We have reached out to the county, and we certainly have made the offer to host vaccination sites within our city. We believe that our community needs a more convenient location for their vaccinations. And we so far haven't been able to, when we were requesting it, get authorization. But then under a different department in the county, we were asked to serve as a pilot program through the county's Office of Aging to do vaccines. So we were really excited about it. Lisa Rudloff, the executive director of Parks and Rec, really worked hard at making sure the pilot went smoothly, because what we were hoping is if we do this one successful, maybe we'll have the opportunity to handle the logistics for future vaccines. So we did in January have a vaccination program at the Southwest Senior Center. I'm sorry, can you still hear me?
Yes, we're
Okay.
fine. Go ahead.
Okay, so we had the pilot program. It was 500 vaccines. The individuals that were vaccinated were primarily the seniors that received assistance programs from that senior center. And it had a few hiccups, but it went very well. There is a second one scheduled, but it's primarily for just administering the second dose to those seniors that received it. But we are trying weekly. I have conversations with the county, with other city managers, with Dr. Chow, with Frank Kim, and we continue to make the plea that, we're open to hosting vaccination within our city. I know that this school district, Santa Ana Unified School District, has made the same plea. So we're keeping our fingers crossed that we'll be able to bring one that will be a lot more convenient to our community. We did just recently find out that Albertsons at 2000 East and 17th Street in our city has vaccines, and they are going to be opening up for vaccinations this Saturday, January 30th. And it is reserved for residents of Santa Ana and Anaheim. And there is a link to sign up. And I know that my PIO is on the call in this meeting, so that's something he can certainly provide at the end of the meeting if any of you want to go in there and sign up and find out what the requirements are. And possibly, Carl, you can get your jab in your arm on Saturday.
Well, I did want to tell you, but I did take advantage of that. We had a friend who notified me today about 3 o'clock, and my wife and I are going to get jabbed at 9:30 on Saturday. So there are appointments open. So if he can pass that link on to those out there, that is fantastic. That would be fantastic.
Okay. So the bright news is, as the vaccinations roll out and as we have people that are immune to it, it's going to be a great boon to our community and to all the members. And we're fighting hard to try to make that happen. With the testing sites that we are rolling out, we do believe that they could easily be converted into vaccination sites. So I know I mentioned the testing site at Santa Ana College, Wednesday through Sunday. We also will, as time goes by, add additional testing centers throughout the community at different community centers. I'm sure I've probably talked longer than what you had allocated for me, but I'm certainly available to answer any questions. I know my assistant to the city manager who is on the call, that is Daisy, and that is she recently received a promotion to that position. And I have to give a shout out to her because she was one of the key people behind the CARES program and working tirelessly on that. And as well as I mentioned before, my PIO is also on the call. So Carl, if you would like, the three of us are available for any questions.
Carl, I have a question right off the bat.
Go ahead.
Kristine, the county sign up had no information in Spanish or Vietnamese. I think that's an issue, you know, in this city. You know, if you're going to roll out a program and sign people up for vaccinations, it should be in at least those three languages: English, Spanish, and Vietnamese.
Peter, I completely agree with you, and the Board of Supervisors have been receiving criticism on that. I know that they did their appointment through an app, and it did have other challenges in addition to not being accessible for large portions of our community. So that's not the first time I heard that, and I agree completely with you. I know all the efforts that we have done at the city, we have put out all of the communications in those three languages for our community. But thank you for that comment. If I have the opportunity, I certainly will pass it on as well.
Thank you.
I think Captain Horner is getting his questions already. But anyone that has a question, please raise your hand. You have the little icon on the bottom of the screen that will allow you to ask questions. I know, Lisa, are we getting any questions? George, go ahead.
Yes, you said there were about 500 people that have died here in Santa Ana. Do you have demographics on these people so we know what our target audience is to educate?
I'll answer part of it, and then I'll defer to my PO if he knows location. We do have, and the county has been tracking by zip code area. And we do know that out of the county of Orange, the highest incident of COVID are in particular zip codes within the Anaheim and Santa Ana area. I'm not aware that we know the location or the zip code associated with those 500 deaths. So Paul, is that information that you have?
Hi, I don't know if it's broken, the deaths are broken down by zip code. I know that case numbers are, and I know our Emergency Operations Center, police department, has been tracking all the data the county provides. But I do know at the outset they were a little reluctant to provide a lot of that sort of demographic detail at that level. But something I'll look at here. But I don't believe that we have deaths by zip code, and I don't think that we have a lot of details for our area on age or other demographics. I think there are countywide demographics that they have data on the county website that look at the age of the people who died from COVID and some other factors, but I don't think that we have it specifically to our city. But I'll check on that. Also, on another note, just on the Albertsons vaccination site that's happening on Saturday, that will be up on our website on the homepage under notifications at the top here momentarily with information about that and a link so that everyone who qualifies to make an appointment. It's by appointment only, age 65 and older, Santa Ana or Anaheim resident.
There are two questions that I have that come to me across the question and answer, and I'm going to refer both of these to Captain Horner when he talks. But what they're asking for is who's eligible for the vaccine and how do we get it, and then also what sites are out there, and then also a concern about a third one, Athena website. Have not had any luck with that on it. So we'll say that for Captain Horner's section here. Are there any other questions out there anybody has? Please.
Carl,
Yes.
Carl, this is Margarita. So we have two hands raised.
Go ahead.
I know once is from France Shima, and we have Adriana Soto. So let's start with France Shima. Go ahead.
Hi, thank you so much. Yeah, I was the one that sent in that question about Athena. I registered my parents about a week ago. I was able to get on their website, no problem, but I was never given an appointment for them, and I haven't had a response from them either.
Do you go back, Francine, and check on it?
It's France, and what was that?
France, do you go and check on the site?
I haven't since then. I gave them my email. They requested my email, but I two different emails, because apparently each of my parents have to have their own email, but they don't have any emails.
Right.
So I sent both my emails and I haven't heard back.
I understand. I was in the same situation. I've gone back and checked my status. You can do that. I wish they would have given us numbers, and then we would have known where we are, but it is what it is. Unfortunately, I became aware of Albinson's this afternoon. I was able to respond on it.
Thank you, Franz, for your question.
So are you saying to go back on the website?
Go back on the website. It'll ask you whether you're first, or it has a section in there for login. Now with your parents, you had to put their name, you had to put a password.
Right.
Yep, just put all that in, come back. And what happened to me is that my wife and I signed up on a day, and I went a week later, and for some reason mine disappeared, so I had to re-register, but hers was there. Now we've gone from no vaccines to telling us that we are in the waiting room, but I have not got an appointment through there either. But
And then do you know what kind is it, where they're coming from? Is it Moderna, Johnson & Johnson, or Pfizer?
I do not know. Maybe Captain Horner will when we get to that section, but I do not know.
All right, thank you.
Thank you,
Thank you.
Franz. We're going to continue with Adriana Soto.
Hi, good evening. I just had a question. First off, I wanted to thank Santa Ana for what they did with Santa Ana Cares. I think that was just amazing on just the response that we had for the COVID-19 testing and everywhere. I think on social media, we knew where the locations were. They were on our bike trails. There were the tour of the parks, and that was super helpful for our community. But I also think that the response for educating our community and promoting the Athena application has not been the same. I registered my parents, just as the other caller, I registered my parents probably over 2 weeks ago. I check every day. I'm very tech savvy, so I was able to, register, fill in their information, checking on a daily basis, multiple times a day. And it was a little frustrating because I know they had a lot of issues on their part. Luckily, I was able to get their appointment, both of them today. And so they'll be going to Disneyland this Saturday to get their appointment. But I also feel like our community is not responding the same to the vaccines. I feel like we need to, one, promote the Athena app if that's what it is. Two, I really do think that we need a pod in Santa Ana. We know that the need is here. We know that we're being hit the hardest. Our zip code in Orange County, mine's 92707. I know we've been one of the top 5 zip codes in our community. And I just feel like we're not getting the education out there to them. I feel that we need to, again, promote and educate our community so they are looking to, get the vaccine. And maybe provide more support in, just showing people how to use technology or making it easier for them to get an appointment.
Those are very, very insightful observations, Adriana. We really thank you, because I'm sure the city manager's office, our office is also getting calls, and you're hearing the direct experience from some of the Comlink board members here. So thank you so much. We'll definitely be considering that in our follow-up. I wanted, if that's okay, I wanted to move on because we have a couple of more hands raised. That way we can.
Oh, Margareta, if I could just make one comment for Adriana. Yes, thank you for that feedback. And thank you for the compliments on the CARES program. Those were efforts that were done from your city government. The vaccination is being performed by the County of Orange. So we did not procure or select the Athena app. But in regards to those comments, what we're going to do is when we open up our testing sites, what we will have available for individuals that come in for testing, we're going to have information on rental assistance, but we also can present a kiosk where we can help people maneuver through the Athena app. It isn't our app per se, but we certainly can help with the education efforts for individuals that are trying diligently to sign up for some of those county super pod sites.
Yeah, I completely understand that. I understand that it's something that came from the county and there's a lot of glitches and it has nothing to do with Santa Ana. But like I said, I do feel like we need to support our community in being able in the efforts to sign up. It's out of our hands, right? The application is completely out of our hands, but the educating is not. We can educate our community to know, because there's a lot of, oh, they're putting a chip on us, all these things that the Latino community believes. And they might not be as keen to go sign up. So just educating them in, what the vaccine is and how to go through the application, because it's not okay that our community is being hit the hardest and we're at 12% of Latinos have taken that vaccine. And that's on our OC Health from a few days ago. 12% of Latinos have gotten the vaccine. That's not okay.
Yes, thank you, Adriana. I think there's always a lot more that we can do to educate our community. And I think we've heard it tonight. There's that commitment, whenever we're on the ground, we're going to definitely incorporate some education component to get more of our communities to sign up to be informed, but also for the vaccine. Thank you so much.
Thank you.
I would like to continue with Mr. Campos. Go ahead, Mr. Campos. Mr. Campos, if you can unmute yourself so we can hear your question, that would be great. Okay. Alyssa, I think we had somebody else, Marta. And I think Narcy is interpreting for her right now. So Narcy, if you can ask Marta if she has a question. We saw that she had her hand raised. So while Narcy is checking with that,
Marguerite,
go ahead.
One question. Paul, we could put that connection for Albertson on the chat. I have one person asking, could you please post the link here for the Albertson app? And so if you go on your chat section, you could add that in there.
Yeah, good thought. I'll put that on there. Okay,
thank you, sir. And I do want to thank Adriana, because one of my fears is that I hope in some of our communities that they don't shy away from getting the vaccine for fear that it may disclose their status. And we need to put that behind us. Everybody needs to get vaccinated. I think, Marguerite, if we've got all the questions, and maybe to get to Captain
Yes, let me just turn it back to Narcy,
okay.
In case she did get a question from Marta. Go ahead, Narcy. Oh, she just sent it on the chat. She said that there are different, okay, so this is one of the Spanish callers who is aware that there are different vaccines. How do you know which one to get? And how can we access the Athena app? Many of us are not familiar. Okay, thank you, Marta, for that comment. Captain Horner, is that something that you can address during your presentation?
Yes, I can talk about a lot of stuff going on.
Okay, so let's wrap up with our city manager. Kristine, did you have any closing thoughts?
No, just thank you for inviting me to present, and know that we are working very hard, and I appreciate all of the feedback. We are very much interested in bringing vaccinations right into our community. And one other thing that I didn't mention that is interesting of note, one of the things that we also did as a city is working with UCI, we conducted serology testing. and also interview questions. So that report is still being prepared by UCI, and we should get it within the month. And I think it's going to give us some really good insight into our community. And it does, I think I mentioned before we went live that the preliminary numbers did find that about 30% of our population already does have the antibodies for the virus, which is good news for the future. But thank you again, and for your hard work at keeping all of us communicating. So bye-bye.
Thank you.
Kristine.
Thank you, Kristine.
I'd just like
So-
to add that Paul has put on the chat area the link to Alpacin. And so those that are interested, it is there now on our chat. Captain, let me just add that I know you've been busy man also, and
I'm sorry, Carl, for interrupting. I just had a quick announcement to share before we have Captain Horner start. It's not related to the COVID efforts, but it's important since we have community members on the call. So Alyssa will be sharing her screen. So we just, our team is working along with the general, well, we're part of the general plan team in terms of community outreach. So what we wanted to share with those on the Zoom call is that we are going to be starting to pick up our efforts with the general plan update. So we know that it was continued, and now we are ready to begin some community outreach. We're anticipating completing that in late May, but we just wanted to let you know that we do have information on our general plan update. Specifically, we've been focusing around the topic of environmental justice, what that means. There are 21 neighborhoods in Santa Ana that fall within this area that's designated as an environmental justice area. So part of the community outreach will be, working with organizations, with neighborhood leaders, especially within those 21 neighborhoods, to have some discussions so that there's a better understanding about what that means, why should it matter, and how can residents get involved in that effort. So you will be seeing more information forthcoming, but we just wanted to reference the page. We're looking at a survey that can be completed by the community, but we're also looking at breaking it down a little bit further, like at a neighborhood level, to understand it, and looking at the demographics and the environmental health concerns that are connected to this broader issue of what environmental justice means. So we just wanted to share that brief update. It's not a presentation, but we did want to reference to callers that you can check out our general plan page on the city's website. And there are subfields that give you a lot more detail about environmental justice. So we look forward to your participation and getting others involved through this process. Thank you. Okay, Carl, that was my announcement.
thank you, Marguerite. As people can see, this is live on play.
Yes.
But we're very happy to have Captain Horner with us. He has been working very hard, and in fairness to him, all this was thrown at him early January. Had my opinion, but had the state worked on this in November, December, maybe the rollout would have been a whole lot different. But Captain Horner, I thank you for what you're doing, sir, and bring us up to date what's happening.
Well, thank you very much, Carl, and to the Comlink board and City Manager Ridge, if she's still on, that this is an opportunity to educate everyone on the board and be able to pass the word along on everything that's going on. Yeah, it has been very challenging at best. And I do want to start off by saying there's a lot of things that you heard about from City Manager Ridge about the high level activity going on in the communications with everybody in the county in trying to work this out. Remember, this is history being made right now. None of us have been in a pandemic, and we are now hunting for the vaccine, and how do we distribute it? How do we work these pods? How do we vaccinate all the communities and everybody involved? And so you heard a little bit about what she had mentioned about what's going on, and I'll talk more about the little bit of the level that I've been dealing with, and it should be able to answer some of the questions that is currently a lot of you may have, and then maybe it'll inform you with some of the stuff that we're currently involved with. So with that, let's go to the next slide and talk about the activity. Let's first bring up the fact that COVID itself, we all know that it is very, very contagious. There are many different ways we can contract this, and we're all learning a little bit more about this, but we understand this, that it affects everyone differently in their own little ways, and there's a wide variety of these symptoms. And what's happening is people say, no, I'm fine, but they don't realize that they have been exposed, and you don't know it until the symptoms appear anywhere from 2 to 14 days after the exposure. So by then, some people are asymptomatic, and all of a sudden you hear people say, well, I just had a little bit of a scratchy throat. It's rained out. It's not a big deal. Only come to find out that they go and test at a lot of the sites that have been available now to be COVID positive. Now, let's also talk about some of the employers and realizing that what do they do with the employees? You know, if they test positive, you put them off work, you go and get tested, they confirm the test positive, whether it's the 15-minute one or it's the full and 24-hour test, 24 to 48 hours. But once they confirm the COVID positive, then there's a 10-day period now that people have to go through to confirm that they've gone through the cycle of the COVID vaccine or the COVID virus. But there have been others. When we talk about the different symptoms, people have lost the taste, the smell. And somebody said, I had mild symptoms, and you have everything from A to Z. And that's why it's so confusing for us today to try to put your finger on this pulse and realize, what are we after? We're chasing so many, but we don't see the virus. We don't know it's there. So there's a few things that have been of concern. When you call for 911, our call volume has gone up in the percentage of COVID cases. And as I mentioned before, we're not just going on somebody that doesn't feel well, we're now going on somebody that is now COVID positive. Now that exposes more people in the system, that means the firefighters, the paramedics, the ambulance responding to that location. They're too weak to come out, so you go in their home, and now you have an environment that they have had. There are family members in there, and you walk in and you say, okay, how many people are COVID positive? And there's a wide variety that we run into. The whole family is, or the one person is that could be in isolation. But where is the education for the community to say, look, COVID-19 is serious. We are really at a breaking point with, as we know, the hospitals. Waiting time is anywhere from 2 to 12 hours to drop off a patient. There's a lot of wall time, we call it, for the paramedics because of the amount of people. I happened to speak to a nurse yesterday that basically said, you know, there is 0 beds left in one of our local area hospitals. And when you say 0, they have taken over the flower shop, the store. They put beds in there only to begin to attempt to treat these patients. So when do you call 911? The CDC has the guidelines, but when you have trouble breathing, when you are no longer perfusing, normally we perfuse at 98 to 100%. When you start dropping down in the low 90s, that's when it gets to be a concern. The perfusing means the amount of oxygen in the blood level, just to be able to know that you're exchanging air and you're getting that oxygen that you need. But when you start dropping down into the 80s, that means that the COVID virus has gotten into the lungs and now is causing your O2 saturation levels to drop, which means it's getting serious. When you get into the 80s, it's definitely a bad sign. So you need to get transported to the hospital. If they have blush lips or their face, some people don't even realize they have it, but some other people recognize you look a little different. Are you feeling okay? If you have chest pain or pressure, most people may say, well, they are older, they could have heart problems or chest pain. Sure, but the COVID virus causes that as well. Another new sign that's out there is new confusion. If they're a confused patient, especially as they get older, this confusion is they're not sure what's going on with them, but there's something happening with them. And then a lot of other people will say, I can't wake up, I can't move, and I can't stay awake. It's your body's trying to fight this off, but there's a tremendous amount. So we know that there's a foundational issue that if you're sick and you feel okay, then you self-quarantine, you take your over-the-counter medications and all of that. Well, some of these other things that are happening is people are getting breathing treatments. That's helping them when it comes to the trouble breathing. If you're able to stop that virus from getting into the lungs, then your body's ability to fight that off gets better. But once it gets set into the lungs, and we'll talk about a few of the other issues, then now it goes to a point where the percentage drops even more when you get into a critical care situation. When you go on the ventilator, the percentage is anywhere from 2% to 10% survival rate. A lot of people are getting off the vent because the conditions are getting better. As soon as they're removed from the vent, some people have gone the other way and passed away. So you're hearing these go on because you're altering and changing the body's ability to fight when you're putting them on a greater percentage of oxygen to try to beat this. And they're doing all kinds of other treatments. A lot of you've probably heard immunity, vitamin C, the airborne, try zinc, and all of these things. It depends on some of the symptoms. It depends on what level you're at. So let's go to the next slide. And we know that currently the reason we're doing the vaccinations to the older community first is because they have more severe medical conditions. Not all, but most of them. And some of the issues that really impact them for what we call the severe medical conditions, these are those pre-existing conditions that tend to really impact the older adults if they contract COVID. Number one is the heart disease. Not everybody that has the heart disease has proven that they're going to get COVID and pass away. It's a severe medical condition of that heart disease. The next thing is the diabetes. I'm sure most of you have heard this before, but being a severe diabetic, the type 1 diabetic, that can be very serious as well. And then lastly, is I want to address is the obesity and the extremely overweight. When you have that condition, the body's ability to metabolize and pass along, it doesn't do well with the virus. And one of the nurses that I asked the question about was why the obesity? And she said, they can almost determine that when somebody does come in, that it's going to be a challenge for them. But again, as I mentioned earlier, there's a wide variety of this, but some of these things, there is those commonalities that are occurring. And make no mistake, this is very scary with what we're dealing with. Going into their homes and looking at their faces while we're carrying them out on the gurney, knowing that they've tested positive for COVID and they're on their way to the hospital to get treatment. We know those hospitals are busy. We don't know how severe their condition's going to get. But if they can't even get up and walk outside to meet us out front, again, there's that condition that we talk about that is occurring. So we here in the city, as well as any of the calls, as we wear our PPE, our proper PPE going in, we confirm with the information on the telephone before we arrive on scene, is this a potential COVID call? Have they had a test? So the dispatcher does the pre-arrival questions to determine any and all information. The more information we have, the better we prepare and plan for our treatment before we arrive, because again, this is very, very contagious. Next slide. So some of the cases that I wanted to go over, just some of the numbers when we look at them, is relative to being a hotbed in California and then mainly Orange County. In the United States, 25 million we have of COVID cases. And then in California, we have over 3 million. And then we're right next to LA County, which has over 1 million. And then in Orange County, our numbers are 228,000 and rising. And then you now look at Santa Ana alone. And this number of total cases, 41,354 and growing. And the total number of deaths is 508. Now, as we know that the Thanksgiving get-togethers have all occurred, shortly after that in the time frame, these numbers begin to rise quite a bit. So we started to see this change in the system where we need to get this vaccine out. We need to get all of our sites open so we can begin to vaccinate the public and really change these numbers. But it's a little hard to once this virus spread so quickly and so many have contracted it because of those gatherings and the holidays and those challenges. But when you look at the numbers for the city of Santa Ana, that is tremendous. And to see the amount of work that is going on to get the testing, and the CARES Act had provided a tremendous amount of support to the community, which has been awesome. And not every city was able to do that. We are one of the lucky ones in the city that it happened and we had money allocated to do these things. And an example, what we did in our fire stations in Santa Ana was we got foggers with our vital oxide. We were able to decon fire engines after calls, after these COVID calls in case of potential exposure. We're also deconning our fire stations regularly We're still doing that today. We also were able to get some commercial fans to create ventilation and air movement. The better air movement we have, the less likely we have of being able to contract the COVID. So next slide, please, Margarita. So how do we prevent this and from occurring? And a lot of these changes occur daily and they continue to change. That is what everybody hears. But when you look at the actual transmission of this, is transmitted through the actual body to another body through airborne. If you cough, if you sneeze, or anything at all cause communication, it's out there in a enclosed environment within 2 arm lengths of somebody in a short period of time. This happens. So everyone 2 years and older are suggesting that you wear masks to prevent that. And I've been working the vaccine clinic for the last 2 days now, and watching everybody come in and wear a mask, it really shows how serious the community is taking this to really beat this. But again, this is history being made when you watch this occur. I also heard somebody talking today that Dr. Fauci is recommending that you wear 3 masks, not 1, not just 2, but you wear 3 masks. Well, I don't know about anybody else, but I wear a cloth mask and I wear a N95 underneath that mask. It's actually an insert. And I wear 2 masks and I have a hard time breathing. And if I have to put on a 3rd mask, I don't know how I'm going to be able to exchange that air. But the point is, wearing a mask helps. The second thing is avoid crowds because of the transmission that occurs when you're in a small or a large group and there is a lot of sneeze, throat, communication, it's being spread. Again, human to human. Poorly ventilated spaces. If you're able to turn on a fan, get some cross ventilation going, we're able to at least stop the transmission by creating a well-ventilated space. Wash your hands. A lot of us now, it's normal to just carry hand sanitizer almost everything you touch. Don't rub your eyes. Don't rub your nose or your face. Don't put your fingers in your mouth, because the surfaces that you touch will eventually transmit this COVID by touching and then touching. So we avoid those and using a lot of the hand sanitizer. And the more you wash your hands, the more you can eliminate this. And then lastly is get vaccinated. And you see a lot of the advertisement or the literature information that the vaccines are limited. And the reason for that is because there's so many being distributed immediately, because there's so many that are really wanting the vaccine right now. I read something in Europe that they are running into the shortage because they didn't order early and order enough. So they're a challenge at that point. But if you notice the vaccinations, as you heard City Manager Ridge talk, vaccinations and get these pods and get all of these in place, is awesome, because the more vaccinations into the community, the sooner they begin to build the resistance to the COVID-19 virus. Now, get the vaccination. There are some that maybe some of you have about, and how important it is to build that immunity to it. It doesn't happen right away. So All right. Currently, that are in Orange County. These are the super sites. The first one is at the Disneyland, and the second one is at Soka University. Now, currently, those right now are being managed by a consortium of people and agencies to be able to get enough people together to begin the process. So let's talk about the first shot. The first shot that you get is some of the symptoms that you may have is you're going to get arm soreness. Almost immediately, people start feeling that soreness. You're going to get chills, but they're very minor. You just feel like you're cold and achy. That's exactly what I experienced when I got my first shot. I heard this, and sure enough, it happened. The second thing that I felt was a little bit of a headache and head pressure, but it was very, very mild. It was actually pretty manageable. And then some get a little bit of a slight fever, or they get warm, but it's less than 5% that occurs. So a lot of people have asked the question, is there COVID in these shots, in the vaccine, and is the virus in there? And the answer to that is no. People are a little bit resistant to get it because they're not sure what's in it. There isn't enough data. It's only been a short period of time. You hear a lot of those opposing. But I can share with you that the percentages that have been done, that if we say 25% of the communities get this, we will not get rid of this COVID virus until the year 2024. But if we start going up in percentages, if we get to 65% vaccination of the public, then we're going to get rid of this by June. So the more the percentages go up, the better. The question is it safe? So part of the vaccination site has doctor consultations there that if you have a pre-existing condition, if you're on blood thinners, if you're pregnant, or any of those others, the doctors are there on site to give you the information you need before you get the vaccine. They are medical doctors. They're the ones that have learned a lot about this, and they can provide that information for you. So in the interim, everybody is being encouraged to get this because our ultimate goal is to get to herd immunity. Herd immunity is that new buzzword coming out right now that says if I get the vaccine, I'm going to be able to spread it because I can't contract it because I've had the vaccine. At least the studies have shown that we're able to block it from getting into your body. It works through the messenger RNA. It is a way your body begins to block the messaging from the COVID to not allow it to replicate. So since we get the vaccine, as we build, it doesn't allow that COVID to replicate in your body, which blocks you from that. And ultimately, that's what we want. So the two different manufacturers right now of the vaccine is Pfizer and Moderna. There, I heard the question earlier about Johnson & Johnson. There's another one that may get approval. The Johnson & Johnson's only going to be one shot versus two, but right now the only two that are being administered and that are approved are the Pfizer and the Moderna. Now, the second shot for the Pfizer is 21 days after the first shot. Remember, when you get your first shot, 21 days, you build the percentage of immunity in your body. Then at the 21-day mark, you get the second shot, which is your booster, that now brings you up to the 95%. I met somebody last week who I've known in the fire service for a very long time. That was one of the study cases back in July. And he told me all about his experience and what happened. And he has since been vaccinated, and he has not contracted the COVID virus for 7 months now. He's careful, but he has not contracted it. So he said the study for him was very successful. The Moderna is the other one, and that's 28 days later after the first shot. So again, we need to continue to wear masks, follow the CDC guidelines, and protect ourselves after the first shot, after the second shot, because we need to build. So after your second shot, about 2 weeks it takes to build to that 95%. When you get to that point, then you're at about 95%. So some ask, well, how do you know if it works? How do you know? Well, I can tell you that I had 3 home tests sent to me, and I thought they were COVID tests, but they weren't. They were antibody tests. So when I took it, I came out positive, and I got scared because I thought, oh my gosh, I have, it shows positive. But as I read about the test from the manufacturer that made that test, it showed that I was positive for not the antibodies, because I had an antibody test and I didn't have the antibodies, but I was positive for the vaccine. So it showed up during that test. So I was convinced that after this vaccine that I've actually seen proof that it's working. And I was happy about that because I saw the results. So after the second shot, what I experienced more was a lot sore on my arm. I felt like somebody took a bigger bat this time to hit me. But the trick is you got to keep moving it. But I felt sore. It felt sore for a day, but that was really it. I had head pressure again, and I felt tired this time. This time I felt tired for about a day and a half, a little bit achy. But after that day and a half, because everybody's talking about this second one as being a little bit harder on you. After that, after a day and a half, I went right back to normal, and I felt good. But some of the things that have been occurring is people do experience a little bit different, but it's a lot of the same. So what I did want to do, though, is just briefly throw in a couple things regarding how do I get the vaccine? How do I know how to get to this point? Well, after working 2 days in the Soka University vaccine pod, I've learned a lot about how this is affecting our community. So it is run by county employees on a part-time basis. It's run and managed by the fire department and city staff that is being sent to these locations. And then the rest of it is done by volunteers. And the way this all comes together is by volunteering. And the volunteers that come out, the dentists, the doctors, the nurses, the LVNs, anybody that works in the medical field that can provide the shot. In the clinic itself, in the pod, this is where that vaccine occurs. If we don't have the nurses, the doctors, and the people that have been trained to give the vaccine, nothing else of what we're doing matters when we're running these pods. Now, we have had the ability in the last 2 days at the Soka University to vaccinate. Yesterday, we vaccinated 1,995 people yesterday. Today, we did over 2,000. I left a little early to be able to do this presentation, but we were at those numbers. I would imagine we did about 21 or 2,200 vaccinations today. And I saw somebody I've known in the city of Santa Ana for many years, very influential. I saw him today at the clinic getting his vaccine there at Soka University. And I share that with you because anybody can go to the pods, whether it's Disneyland or Soka University, to get the vaccine. So how do I get the vaccine? Go on to Orange County Health Information, and on their website, they provide you the information. They talk about vaccines are being administered to phase 1 of the healthcare workers and anybody over the age of 65. That's currently who's receiving those. They talk about that on their website. How do I get it? The home testing, and then they take you right down to the Athena website, OTHENA. Margarita, if we could, let's go to the next slide, and that way everybody can hear and follow along. The Athena website, and I'll just talk about this briefly because it's been very challenging. I love the questions that came up, and I heard the stories. And yes, I can share with you that within 1 hour, Athena booked 1,700 appointments in 1 hour. They're getting millions of people on their website every single day. But how do these pod sites work? If they're going to have vaccinators, and they're going to have a large number of them in the clinic, then that is the prediction on how many appointments they can make, all based on the number of vaccinators. It would be a mistake to schedule all of these people to get vaccinated and no vaccinators in the clinic. And I mean the doctors, the nurses, and all of that. So that's done on a daily basis. And it's very challenging because in the global picture of this, we have an incident management team that has been put together by Orange County Healthcare Agency. Dr. Bredhoff is one of the incident commanders, along with Chief Mike Petro from the Orange County Fire Authority. We're using the incident command system to run this whole program for the vaccine pods. In order to do that, we have specialized in running these major incidents for years. And we're working together with a consortium of people to make this happen, with all the different cities and the agencies to make all this happen. And again, with the volunteers. How do I volunteer? Sign up on the website to be able to volunteer to help out. I can share with you the mood that's going on at the vaccine clinic, that it is, people are ecstatic, number one, to get the shot. But number two, the people that are helping make this happen are very supportive of everybody coming in. They're pleasant, they're cordial, they're courteous to everybody coming in. And the experience, I can tell you at Soka, everybody's very happy with that. By the time they arrive, they show that they have an appointment on their phone or a piece of paper. They get directed into the parking structure. They go through registration. They get in the queue line. Once they get inside the gym area for the clinic, they get vaccinated. They wait a 15-minute medical monitoring period. And when they're done, they're out, walk back to their car, and exit out. It's happening 30 minutes to an hour and they're out. We're processing again nearly 2,000 or more people a day at the
Captain
one
Horner?
site.
Captain Horner,
Yeah.
this is Margarita. I just wanted to share some of the comments. And I think Daisy's been responding to some of them. So we had like Mary Lou Branch also relays some of the earlier comments that neighbors saying that they don't have any responses, no available appointment slots, that there's a greater sense of frustration, you know, across people who are just trying to sign up and
Yes.
be proactive as much as possible. So Daisy on the question and answer box, Daisy has shared the link to the Albertson site. And I think Janelle Hardy was able to schedule something. But on the, there are some other comments on the chat from Tay. Thanks for the heads up, you know, about the reactions to the second shot. She had no idea, you know, and so it's really helpful, Captain Horner, the information that you're sharing. But I did want to get to Bobby Keenan's question on just to clarify about your testing that you mentioned. The vaccine will produce antibodies and they will appear in blood tests after you received the vaccine. Other tests look for antigens which indicate the presence of the virus. There are several different tests. PCR is the most sensitive. Positive antigen tests indicate recent or present infection, and antibody tests indicate that your body has either been exposed to the COVID virus or that you've received the vaccine and your immune system, your immune system has responded. So those are Bobby's comments.
Bobby, thank you for that information, because that is invaluable when you learn about this, that your body is building a response to that, as well as getting vaccinated, and they test for the antigens as well. So great information, Bobby. I forgot about the antigen part of it, so thank you.
We've got Angie, Zoom user, who is inquiring what website to volunteer or administer vaccines. Do you have that information, Captain Horner?
Yes, the volunteer is on the website, Orange County Healthcare Agency, and or you can also go on the County of Orange. The challenge that we're having right now is that some of the volunteers that are signing up aren't getting that full response or confirming or a connection. So what we're asking is for members that if they are willing to volunteer, to show up at the clinics or at the sites and just ask them at the front if they need any more volunteers for the day. Because I've run into this the last couple of days, that there are some that have never been contacted and they just showed up. We can use the help, especially tomorrow with the downpour that's going to occur. There's probably going to be about a 40% no show of the volunteers due to the rain and the inclement weather. So we're anticipating that, but we, again, would love to have people come out and volunteer for that.
Thank you. And then there are some people who are already sharing the information about the Albertsons vaccine on the neighborhood app. Manny signed up his parents. And then Bobby Keenan had some other comments on the Athena app, how problematic it is, how it's not important how many people signed up. What's important is knowing when you can get the vaccine and where. Many Santa Ana residents who are at greatest risk for infection are Hispanic. Athena is an all English website. I know that comment was made earlier. Many Santa Ana residents do not have access to the internet. There's no way to find out when you might be able to get an appointment. It's just very problematic and does not serve our citizens well. So,
and that goes back to what City Manager Ridge said when we had the vaccine clinic at the senior center on McFadden. It was an opportunity to drive by and see how things were going. They all gave the thumbs up. Things are going well. They were allotted a certain amount of vaccines for that location, and they were very successful in doing so. Any community vaccines that are available, I encourage anybody and everybody to get it because it will help in the overall picture. So I can share with you a few things about the Athena app. They've been very frustrated with it, even on their end, for the amount of hits that they are getting. When you think about the millions of people that are going on that app and they're having issues with it, they get to a point where they shut the app off because it is not working properly. So when should you go on and look? When do you get a chance to get an appointment? What's happened a lot of time is they will register somebody because they got through, and then they go into the waiting room and they wait in the waiting room until they're contacted. I suggest that you go back on there and continually check the website, because again, when they post every day for those appointments, they go so fast that there's no opportunity to find a spot unless you're continually checking the app. And the other part of it is everybody that does register should have an email address. If they don't have an email address, what's been happening is they sign up under one email address for each individual. That locks them into an appointment if they get one. Then when they get there, they need to change the name in the app when they get registered. But as long as they get that appointment, the saying or the phrase at the vaccine clinics is, you get an appointment, you show proof of that, you get a shot. If you didn't get an appointment, then you don't get the shot, because the vaccines are all calculated for that day. Because remember, the pharmacist has to pull those vaccines, has to draw the vaccines and prepare for that many based on the amount of appointments available. And all of this is coordinated, communicated with the number of vaccinators, people involved in running the clinic, as well as the volunteers.
Yes, Captain, one more question regarding the volunteers from France. She's asking, how are the volunteers protected from possible infection?
Great question. Everybody that is there that goes to get the vaccine has a temperature check. Everybody that is volunteering, everybody wears a mask. Everybody is outside or in a well-ventilated area. So there are protections in place for the volunteers. It's not a matter of, well, we'd like for you to wear the mask. Everybody is wearing the mask for that reason.
Thank you, Captain.
Does that answer that? Mm-hmm.
I think that clarifies, just so that there's some assurances there that the volunteers are doing what they can, everyone to be protected. So I just wanted to finish going over some of the comments on the chat, and then we've got some folks who've raised their hands, Captain Horner, if that's okay.
Sure.
Let's see, so this one, does OCFA have a quick test that can be used when they go to a location for an emergency transport?
No, we are not doing any of the testing, quick tests in the field. We don't have the resources to do that. That has been brought up several times, but no, we don't have that. Most of those are all done at testing locations. Okay.
And then this one is, I don't know if Daisy or Paul are still on the call, but an idea of, this is from Bobby. I know the Santa Ana City Council allocated funds to help in the vaccine distribution. Any other information you have about that?
Yes, hi. Yeah, I was actually just writing an answer in the chat because I wasn't sure if you'd get to me on that. That money was allocated for both testing, additional testing, because that was one of the council's concerns was with the end of the CARES program and that federal funding, we didn't have those local testing sites just for Santa Ana residents. So some of that funding was for that, and then some also is for the vaccinations. So so part of that funding is being put toward the new local testing site that we are starting soon next week, that we'll have more details on, announcing tomorrow. That will be just for Santa Ana residents. And so some of that money is for that. And then also some of the money was used in our recent vaccination event where we vaccinated about, working with the county, vaccinated about almost 500 seniors. And we'll continue to use the funding that we have that the council approved for other future vaccination sites in Santa Ana. As mentioned before, we're working with the county to try to get more of those local sites for vaccinations when we can.
Thank you, Paul.
You're welcome.
And then another comment from Bobby Keenan. I suggest we do the same thing we did when the polio vaccine first came available. I am over 65, so I remember vaccines were available at community, university clinics, and also schools and churches and neighborhoods. So people without transportation could walk to get a vaccine. It really worked. Did anybody think about that? I think it would be much better if public health professionals had been involved in the planning for the distribution.
Yeah, we talked about that. As a matter of fact, that came up today, and the discussions about the availability of the vaccines and the distribution of it. Right now, we don't have the unlimited amount of vaccines. It is very tightly regulated and limited right now. I would imagine that eventually we're going to get there, but right now, as it is, that's why we're doing what we're doing with these pod sites. It's challenging, but we're able to have a process right now until other decisions are being made. Again, a lot of this is being done by the recent planning and some of the new plans. Now, right now, currently, the 2 pod sites can take more. So we're going to maximize that. And then as soon as those are completely maximized, then they'll start doing other pod sites. It was mentioned the fairgrounds, the Great Park, and some other locations where they can perform these. But it is a big machine to run these, to be able to move that large number of people. Where do they park? You know, how do you line them up? Tonight, it's going to rain. So all day tomorrow, it's going to be challenging now because we got to bring them into a place. We hope they don't trip. We don't hope they don't fall. We've got a lot of handicaps, people that we have to get into the clinic. And so wheelchairs, assistants, there's a lot that goes with it. We have to have the facilities to be able to move and a location to move that a large number of people. And I'm very happy to hear that Albertsons is doing that 2017. Again, this is just more accessibility to do that. But if I can address one thing, Paul, I did get the zip codes. And the zip codes do show the number of deaths per zip code. And if I read them real quick, 92701 has 101 deaths in that zip code. 92703, there's 82 of them. 92704 is 113, and that's the highest one. 92705 is only a portion of that zip code, is 59. 92706 is 54. And then 92707, a portion of that, and there's 92 in that one. And Paul, you can get that from Steve Reiner from the EOC on that. So I just found those and I wanted to read those.
Thank you, Captain Horner. Yeah, and you know, I thought too later that number is available as well. The county has a lot of data on the OC Health website for people. So if you guys want to, look there, you can always find data. It does have the zip code data and city data, and for both cases and deaths. I think what it doesn't do at the zip code level or even city levels break down like demographics, right? But it does have county-wide demographic numbers.
Yes.
Yeah. So, but there's a lot of good data there.
So I can share with the group this, that the Athena app is very, very difficult. That is different than app than LA County's using or San Diego County's using. And so each one is having some challenges, but I'm not sure if Athena is going to be the one that's going to continue or if they're going to look at other opportunities. I'm not sure. But just be patient. I know it's tough. There's a lot of emotion. I've seen a lot of emotion these last 2 days in the clinic. I'm scheduled to work the next 8 days, every day in the clinic until next Thursday. So that is my duties, along with Chief Henry, and what we're doing is a responsibility to get this thing continuing to run and expand it as much as we can. So another thing that I did here is the tiers. Right now, everybody's reading the tiers. Tier 1A, Tier 1B. They're thinking an opportunity to get away from those and just do the age groups. Do the 40s to 50s, the 30s to 40s, and maybe simplify a little bit more. I don't know how much traction that's going to get, but I think it's heading that way. Some people are showing up at the end of the day and saying, hey, is there any leftover vaccines? So there's standby lines that are being created. That's not true. There are some at the end of the day, but it's so tightly calculated that there may be one or two. What's happening is you get 10 to 20 or 30 people in a standby line at the end of the day. And then when you say, I'm sorry, we don't have any more vaccines, then you hear a range of emotions. So currently right now, the public or private providers that are out there right now to be able to give the vaccines, more and more people. I just spoke to one of the dentists that said we have access to 175 dentists that we can provide vaccinators for this. So instead of running 2 clinics, we can run 4 clinics here and the large amount over at Disneyland to increase it. The goal ultimately is to get herd immunity, prevent the outbreaks from having those gatherings. I had heard something the last couple of days about Wuhan, China having another outbreak, and that things are reoccurring. I don't know. I didn't do any research on that, but I know that you hear of the outbreaks occurring from the large gatherings, and that's where they're trying to prevent that. So what does the future hold for us? Every day that goes by, we're getting more and more people vaccinated, which means more and more people can be resistant to it. And then what can we do to help as a community? Volunteer, continue to sign up, continue to spread the message through the neighborhood groups. And that's one of the reasons why I wanted to do the presentation tonight, so we can spread the word to the community of Santa Ana so everybody gets this information. And if we get those pods in Santa Ana and able to, that would be outstanding. We would be there every day to help administer these and get it done. So with that,
Captain Horner, we have some folks that have raised their hand, and yeah, we just received word that the Saturday appointments at Albertsons are all filled up. Yep. And I got a message from Lisa Solomon that Duke Juarez from OCFA vaccinated her 99-year-old grandma. So she just wanted to share her thanks and gratitude for that.
And I have to tell you, Duke is getting so much notoriety. He's number 1, the fastest vaccinator, and 2, the most handsome. So that's about all I can tell you, you know?
Okay. Let's go to the to folks who have raised their hand. So let's try our Campos one more time. If you have a question for Captain Horner, we just need you to unmute your mic. And then we have, so we haven't heard from our campus. So let's move on to Martha Serrano. Martha Serrano, see, I think Narce is interpreting for Martha, so Narce can
Okay.
will get that information to us. And then after Martha, after we receive Martha's translated question, we'll go to Gloria Diaz, Adriana Soto, and Bobby Keenan. Well, maybe let's go to Gloria Diaz since we're waiting on Martha. Gloria, go ahead.
Yes, so you've already answered my question. Thank you so much. It was about a phone number for the appointment for the Albertsons.
Oh, yes. Okay. Thank you, Gloria.
Yes, thank you. Bye-bye.
Okay. So Narcy, do we have anything from Marta Serrano?
Good night.
Okay, so let's go to, okay, so Narcy just sent us on the chat. Which vaccine do you recommend, and do you have a choice on the vaccine that you want?
No, I don't have a recommendation. And the reason I don't is because there's a little bit of differences between the two of them, but they're both been proven to be fairly effective and virtually very little reaction to either one. Now, as far as choice goes, I happened to get the Moderna. That was the one that was issued to us as firefighters at OCFA. So I took the Moderna one, and again, those were just some of my reactions. At the SoCA University pod, they're vaccinating everybody with the Pfizer vaccine. So I don't think there's too many options. You've heard a few differences out there, but I haven't heard of anything so significant that I tell you, go get the Pfizer, not the Moderna, because I haven't heard of any big differences either way. Now, there is a difference between the age group that you don't want to be, you have to be 16 years and older to get the Pfizer, and 18 years and older to get the Moderna. That's about the only differences, and the temperature in which they're stored.
Excellent.
But that's about the only differences that I'm aware of.
Thank you, Captain Horner, and thank you, Marta, for the question, and RC for translating. Let's go to Adriana Soto. Go ahead, Adriana.
So good evening again, and I just wanted to express the gratitude for giving us this platform to be able to share and share this great information. I'm very, very grateful, Mr. Horner. I'm sure 8 days in a row working, and I'm sure it's not an easy task. So thank you so much. Thank you again for, I was able to share that Albertsons information before it was released to our community. And I know at least 8 people that I shared it with were able to get those appointments.
Excellent.
And we see that need, right? They were filled up so quickly, and we see the need. And again, I just want to, say thank you. But again, remembering that we need to close that gap in our community. We understand that Athena is a very complicated app. It was complicated for me. And like I said, I think I'm pretty good at technology. So knowing the community, just again, remembering that we need, to educate our community again and giving them more guidance. I don't know, like a call center specifically for our community, something where we're being able to guide them on how to create these appointments. Because like I said, it's very complicated for people who know technology. And we know that in Santa Ana, there's a lot of people that don't even know how to turn on a computer, that don't have email, that don't have, so something that we need to do that. Just wanted to share that again, but thank you again.
Yeah, Adriana, if I can respond, that there is a lot of reactionary stuff going on the Athena app staff. They're still experiencing quite a bit of pushback with things that are recurring. So it isn't as much proactive as it is reactive right now because of the large number of hits that they're getting and demands on their app. It's very challenging for them going on, and there's a lot of internal struggles and things happening that you're seeing occur because there's always these one-offs that are occurring right now that become very challenging. And so I've heard of a few things, but what we're encouraging everybody to do is the longer that this goes on, the more people will become educated with what's happening. Once they do that, it will become a regular thing. Let's say 6 months from now, they'll hand out flyers and information. Oh, here's the Athena app if you want the vaccine. Right now, people are just starting to get introduced to it. And you hear it flying around now, like, Athena, what's that? Well, that's how you get the appointment. And so now it's starting to spread a little bit more, which is good. But I do agree, it needs to be out in the forefront so everybody has that information and everybody gets that fair and consistent opportunity to get vaccinated.
Thank you, Captain, and thank you, Adriana. I wanted to take it to our last caller, the question, Bobby Keenan. Go ahead, Bobby.
Oh, thank you so much. I want to echo my agreement with what Adriana just said and express also my gratitude for all of you being here tonight, and Stephen for the really fine presentation that you gave, and Paul for your explanations, and of course for all the other people that have given so much to our community for so many years through Comlink. I want to say about the Athena app that it has just been totally inadequate for our needs. I am, as a homeowner and a resident of Santa Ana since 1992, really unhappy that this contract was awarded with no public input, with no public health input, and they're doing a terrible job. And now we've invested so much in them that it's almost impossible to just change horses during the race. Primarily, the very first thing is that they did not have anything in Spanish language, when most of the people in our community, or many of the people in our community, are Spanish speaking, without computers, some without private transportation, many with jobs that are essential jobs, so they can't stay home and quarantine. They're completely ignored by this website and this plan, and that's unconscionable. It's just a huge disservice to the people of Santa Ana, and I'm really angry about it. I want to say that if we are going to rescue the disaster of the Athena contract, they need to address the Hispanic speaking community. You can tell by the comments here how important that is, because so many of them came in Spanish language, which I've been too lazy to learn over these 20 some years. But I just think this is terrible. We need to make much better planning very quickly. Another thing that is really crucial in this effort is that there are new emergent strains of viruses that may be resistant to the vaccines that we have available. And it is really important to immunize as many people as quickly as we can to offset that threat. I've lost 2 family members to this epidemic.
Wow.
I'm angry and sad, and I'm very disappointed with this. I've spent 20 hours over the last 2 weeks just trying to figure out how I can get vaccinated so that I can be safe to volunteer to help. I'm a retired nurse. I want to help. I know how important this is. I completely out of the blue got an email from one of my neighbors today to tell me about the Albertson site. And I have an appointment on Saturday. I have no idea when Athena would give me an appointment because I'm in a waiting room with 460,000 plus other people. And at St. Joe's, my appointment was at the end of February. It's going to take me 8 weeks to get safe enough to volunteer. That's too long. This is not good. We need to fix this. And I encourage our city council, our county supervisors, and our public health authorities to help fix this as soon as possible. I also want to say that in terms of the administration of our county healthcare agency, the administration does not have, I think they have 1 or 2 of their top administration people who have any public health expertise. I mean, the head of it, Clayton Chow, is a wonderful doctor, a wonderful man. I worked with him for years before I retired, but he's a psychiatrist. He doesn't have a public health background, and this is falling on his shoulders. This is not the way to approach this problem. We need to talk seriously with the public health experts in our community, and there are many, and let them assume a position of leadership in going forward. And I really thank you all for this opportunity, for the people of Santa Ana to learn more about this, and for the opportunity to express my opinion. Thank you.
Thank you so much, Bobby. And we're so sorry to hear that you lost, and anybody else who was on the call who's lost somebody to the virus.
There's
It's
so
just
many.
very, very saddening. But just thank you for sharing all your insights to the chat, the questions. I think you really hit it on, with having a strategy that can be successful, in our community. I just wanted to turn it to Paul or Captain Horner, any closing thoughts, and then back to Carl Veninger. So go, Captain or Paul. Captain Horner.
Yes.
Oh, sorry. Oh, hi. I was muted two
Paul.
places here.
Okay. Go ahead, Paul. You first, and then Captain Horner.
Thank you. Yeah, thank you for taking the time, for Captain Horner taking so much time to explain all of these things. I think it really helps people to hear about the process and what's been going on behind the scenes, because it is, as you said, a massive undertaking. And I know that the county is working as hard as they can to get this rolled out, and we have been working as hard as we can to do whatever we can to support the county in this and all of the various COVID efforts that we've been doing these last months. So it's been a very difficult year for everyone, obviously. But I'd like to think that there's a light at the end of the tunnel here as all of this moves forward with the vaccine, and hopefully people will keep doing the right thing and wearing masks and social distancing and all that as we go forward. And just please sign up for the City of Santa Ana if you haven't already for Nixle alerts on the Nixle alert system. Sign up, and I put the link in the chat on that. Follow us on social media. Check our website. We have a COVID page where we put together a lot of information about both all of our resources, as well as links to a lot of the county sites and CDC and state sites, and for vaccines and other COVID-related things. So we're trying to put a lot of information out there to everyone, so you all know what's going on. So please just keep watching us and listening, and hopefully we'll all be in a better position soon in these coming months to get things under control and make sure everyone gets vaccinated. Thank you.
Captain?
Well, I just want to say thank you to everyone to give me the opportunity to share the information and be able to give you an insight on what we're doing and what's happening out there. And, we're all in this together. And the way we're going to be able to beat this is vaccinate, follow the CDC guidelines, and take care of each other in this, because this is a very, very serious pandemic, as you've heard and you see, and we need to get this out of our way. And it's every day is a process that we get that answer to. They're talking about different ideas, and that's great. It's good to hear that we may do a drive-through clinic where people stay in their car and don't get out of the vehicles, and do it at multiple sites and things like that are occurring. And having City Manager Ridge put all of these opportunities out there to be able to get this done for the community of Santa Ana is awesome. So thank you very much for your time.
Thank you, Captain Horner, so much. Very insightful, valuable information to share with others. Let's go back to Carl Benninger. Carl?
Well, I do have one question for Captain Horner.
Okay.
Over the last couple of weeks, I missed the opportunity at Care Ambulance that was giving vaccines for a week, and they had walk-in at that time. I've been signed up for Athena forever. And so it's word of mouth that I've heard now about Albertson. I'll be getting my shot on Saturday. But
Okay.
how does Care Ambulance end up getting vaccines for a short period of time? Do you guys know that's happening, or?
Yeah, and that's part of the private industry helping out with the vaccines. They have to have people lined up to be able to provide the service. Somebody who can handle the vaccine, somebody that can administer the vaccine, and all of that. It does take some prep work in order to do that. You can't just put a site there without having some restrictions that are met, that are placed by the healthcare agency to ensure that it's being done correctly.
But
And
how do we find out Albertson's going to do it, or Care, or Walgreens? How do we find that out of the private area? Because right now it's word of mouth, basically.
Right now, a lot of these are coming up in different locations, and there is no advertisement that's occurring unless people hear about it. Again, it is searching the website for the vaccine and punching that information up, because remember, eventually when they do get it, they have to put that information out somewhere. And that's where you find that most everything is being administered and approved by Orange County Healthcare Agency. But I am not sure how the Albertsons advertised it, but I think it's awesome, because again, there's another opportunity for 500 more people, or 1,000, whatever they've been allotted, to vaccinate. And if that goes very well, I'm sure they're going to keep doing that.
Yeah, I found out because a friend who used to work there got called saying this is happening. And so he called me, and I know at least 10 people that I've gotten over there that made appointments because my friend told me about it. And that's
and again, it's as that cooperation, communication, and coordination occurs with the pods, they'll continue to expand, because the need is there, no doubt. We just have a need to be able to support these, run them, operate them, and make them successful. So,
Carl, I want to make one important key factor here. We need to get the word out that vaccines are free. There are people being duped into paying money to be standing in line, only not to have an appointment. And it's a white scam that's going on out there. So we need to let people know that all vaccines are free.
Yes,
Thank you.
yes. Thank you, Peter.
Okay, Carl.
Thank you, Captain Horner. We very much appreciate it.
You're welcome.
And
Everybody have a good evening. Thank you.
okay.
Thank you, everyone. It looks like this is a wrap, and we appreciate everyone staying
Just
here. Oh, go ahead, Carl. Sorry.
remind everybody, our next meeting is February 25th, is our next Comlink meeting, and more than welcome to everyone aboard. And we thank both Captain Horner and City Manager Ridge being with us today, and I hope everyone found it educational. And Paul and Daisy, thank you for your time and effort. With that, good night to everybody, and we'll see you in a month. Stay healthy.
Good night.